you do clinical supervision in the first place. Many people do it for licensure or for training purposes. But in fact, we're getting enormous research that's being generated internationally, much of it in Canada, but some from Europe, from Australia, multiple venues, in which what we're finding is that evidence-based practices are being rolled out in many systems, as they have been in your system. And the results are showing us that implementation goes much smoother if, in fact, there's supportive clinical supervision and consultation that's occurring during the process of implementation. Furthermore, there's greater fidelity, which means that the model is actually implemented much more in line with what the developers of the model had intended. And fidelity is a critical piece of evidence-based performance and evidence-based practices. Furthermore, the supportive quality of the supervision, in fact, provides for career development of the supervisee and conversely for the supervisor, in that both learn from the other. Interestingly, in a huge study that was done on substance abuse in co-occurring diagnosis clients with whom the clinicians had a really high burnout rate. It was really a critical issue that they were seeing so many people burning out because of the severity of the clients. Once clinical supervision was in fact introduced, there was a reduction in what's called turnover intent. Turnover intent is thinking about leaving, not necessarily giving one's resignation yet, but at least having serious thoughts about it. And turnover intent is a major predictor of burnout. Burnout is something we want to avoid at all costs. Emotional exhaustion is also along that trajectory from turnover intent, emotional exhaustion, and then burnout. And both emotional exhaustion and turnover intent were reduced with supportive clinical supervision. A new effort, which is just coming into the forefront, is looking at treatment outcomes and how treatment outcomes are impacted by supervision. And what the research is showing us increasingly is that clinical supervision is enhancing treatment outcomes. Some of this work comes out of Australia, but Scott Miller, who has done some work with the provincial government, is also finding astonishing results in terms of outcomes being enhanced through clinical supervision. And this is client outcomes, so this is really important data. We knew before that certain clinicians are associated with greater treatment outcomes generally, but now we're getting data that in fact it's not just the clinicians, it's also the supervisors who can be associated with better clinical outcomes. And in a study of this, Callahan et al. In 2009 found that certain supervisors are associated with better client outcomes. And this was a significant effect. And some of the things that they found were that the supervisors who had more advanced training and more specialized training might be associated with enhanced client outcomes. This is an area of great interest, and more studies are planned to be done. So here's a picture of how this all fits together, that emotional exhaustion relates to turnover intent. And this is a threat to quality of care. It's definitely a threat to evidence-based practices, which have been taught because the individuals who learn the evidence-based practices may leave, and that's not good. And there are negative health outcomes, which is a very negative impact of emotional exhaustion. Then it relates to overall organizational phenomena. And what the researchers are saying is that clinical supervision can impact all of those different realms. What we're finding is also that supervision is essential to the transmission of the practice of mental health disciplines. And it's been identified as a major factor in supervisee/staff development, in professional development in general, and even in supervisor development. Let's move to definitions of clinical supervision. Many of you in your training studied clinical supervision. You know there's a wide range of definitions. And there's agreement and disagreement on various aspects of them. One of the dimensions that's been central to this is hierarchy versus collaboration. And that is, should the supervisor simply be giving information and speaking to the supervisees, or should it be a collaborative relationship in which there's interaction between the recipient and the supervisor? And should the supervisee have an active role in the supervision process? A second dimension is developmental frame, and that is that supervisees and supervisors progress through a certain sequence in development. But what happens is, at the beginning, supervisees are more dependent, they're highly motivated, and sometimes they're less focused on the client and more focused on their own process and also on their own performance. With development, supervisees become increasingly autonomous and become increasingly integrative of various perspectives. Similarly, beginning supervisors report that they often feel like an imposter. They feel like suddenly they were promoted to be a supervisor and they don't know anything different than they knew the day before when they were a supervisee. So it's a difficult transition sometimes with a lot of changes and a lot of a transformation of thinking about the whole process of supervision and what it means and what the leadership role entails.